Sleep apnea can be broken down into two categories. One is obstructive sleep apnea that we see the most of. That is when people fall asleep, and when their muscles relax, you actually have muscles that help keep your throat open. Keeps the tongue from falling into the back of the throat. Now when that muscle relaxes, the tongue falls back, it starts to obstruct the airway, people start snoring, and that graduates a little further into deeper sleep, into the point where the airway will actually get obstructed by the tongue. Now when that happens, you have no idea that you're doing this, but your brain will get that signal that you're not getting enough air, you're getting choked. So your brain wakes you up just for a couple of seconds, you pop your throat back open, you take a nice deep breath, everything relaxes, and you go right back to sleep, not even realizing that that just happened to you. Now, if you do happen to have a sleep partner, they will notice this as a choking and gasping spell, but again, the patient typically has no idea that they're doing this. So I hear that a lot. I do get quite a few patients that are sent to me by other clinicians that they're concerned about possible sleep apnea, and the patient tells me that I don't have any sleep problems, I feel great as far as how much sleep I'm getting. Well, the problem is people that can sleep anywhere, any place, anytime, that's not normal. You're not supposed to be able to sleep anywhere, anytime. You're supposed to sleep for 7 hours to 8 hours a night and not have to be sleepy during the day and have to take a nap. So when you are sleeping all the time, that's actually a sign that you may have something else going on that we need to be looking at and paying attention to. The most frequent symptom we're going to see is daytime sleepiness, and people are going to come in complaining that some of them are even getting to the point of falling asleep at the wheel. Their work is being affected, their productivity, their memory. These things can all be affected by not getting a good night's sleep. So the other symptoms we will see, people can have dry mouth in the morning when they first get up, and even headaches. And if you wake up with a morning headache, that can be a symptom that you're not getting enough oxygen to your brain. That is obviously a problem, and that is an indication that you may have some sleep apnea issues. With sleep apnea, the majority of the people we're going to see is because of daytime sleepiness, but the things that people don't realize is that this is actually affecting your health. When they have that event that I described where they obstruct, that's a fight or flight response that your body hits. And when that happens, your heart rate goes up, your blood pressure shoots up, you release a stress hormone in the body that makes your sugar go up. So you can in turn end up having issues with high blood pressure, heart arrhythmias, heart failure, and even stroke. People have to undergo some sort of sleep study. Now there's two types of studies that we do. The most thorough study is the one in the sleep center, and this is when people will come in, spend the night. We put multiple different monitors on them. And staying in the sleep center is kind of like staying in a hotel. You get your own bedroom, bathroom, etc. There will be a technician there that monitors you throughout the night. If you need anything, you hit the little button and they come running. And the next morning we get folks up and we talk to them about their sleep studies and give them their results. Now the other option is a home sleep study. Now the home sleep study is not in near as much detail. It's only a couple of monitors that we place on people, but it does give them the ability to have this study done in their own home. Sometimes it has to do with what insurance is going to pay for mobility issues. Sometimes we try to accommodate the patient that way, but the most thorough study is going to be in the lab. Within one night, many times when we put people on CPAP, they will feel significantly better the next day. It's tremendous for me to see some of these patients come back in clinic and explained to me how they got their quality of life back. And that is a huge deal for a lot of folks that haven't been sleeping in years. And finally, they're starting to feel normal again because they forgot what normal was like. And so it's truly amazing to see people do that. And then all of a sudden you start getting people off of some of their blood pressure pills or off of some of their heart pills because all of a sudden that's starting to do better. Even sugars get better. And so it is great to see in that particular area, their quality of life improves.